Hello, welcome or welcome back to my channel. If you didn't know, my name's Ashmita and I'm currently doing a series on the coronavirus pandemic. If you guys haven't watched the first 3 episodes of this series, I'll link them down below. I strongly recommend you guys to watch those episodes out first because it gives more information on the pandemic scientifically. In this episode, I'll be talking about policies. I'll split the policy aspect of the pandemic in 2 parts. So in this video, I'll be talking about why we need policies and the general policies that have been placed. And in the next episode, I'll be discussing how specific countries responded to the pandemic in terms of its policies. So in this episode, I'll be discussing 4 major topics, which include the role of transmission in policymaking, the challenges that are being faced in terms of implementing these policies, the crisis that is occurring in healthcare systems, and the role of IPC, which stands for Infection Prevention and Control. The primary goal of policymakers is to effectively contain the virus so that it doesn't spread to the community and worldwide. This is an area where both scientists and policymakers have to work together so that effective policies are implemented. And this is where the first topic comes in, which is the role of transmission in making policies. So the first thing policymakers have to understand in order to make the policies is how the disease transmits or spreads. So in terms of COVID-19, it spreads through asymptomatic, pre-symptomatic, and symptomatic people. So in terms of symptomatic people, it spreads through droplets, direct contact with infected people, and contact with objects or surfaces that have been touched by infected people. So this suggests that healthy people have to avoid contact with infected people, and that infected people should be isolated away from the community. Also, healthy people have to avoid any contact with surfaces or objects, and even if they touch the surfaces or objects, they can't touch their faces. Because of the way COVID-19 spreads, staffs have been ordered to wear masks, gloves, eye protection, and gowns when they're within 1 meter of the patient, and additionally there has been environmental cleaning done through detergents and disinfectants. Because the virus is mutating and scientists don't know whether the virus has become airborne or not, many countries are implementing airborne precautions such as isolating patients in a naturally well ventilated room. On top of that, health workers also have to wear fit tested respirators. The next topic that I'll be discussing is the current challenges that are being faced in terms of policies. So countries without an infection prevention and control program, training programs, and staff, it is hard for them to basically implement IPC. So these challenges are specific to the health facility. The surveillance is also proving to be a huge challenge because obviously the symptoms are similar to other diseases. And since scientists are finding more and more about the novel coronavirus, the definition will inevitably change, which will put more pressure on healthcare services. Additionally, for overcrowded healthcare facilities, it is difficult for them to maintain social distancing and also locate where the isolation rooms and wards will be at. The next topic that I'll be discussing is the worldwide crisis that is currently occurring in healthcare systems. So the COVID-19 pandemic is causing a lot of crisis in healthcare services, especially in Europe and USA. This is because people don't have adequate access to PPE, which stands for personal protective equipment. So in the USA, there are not enough equipment for the critically ill, and they don't have enough ventilators. On top of that, they need more respirators and surgical masks. And in Italy, there's more death rates and infections because they have inadequate access to PPE. A major reason for this shortage is because China is one of the main producers for PPE and masks. So because Wuhan, which is in China, was the epicenter for this virus, manufacturing, production, and exportation for PPE and masks stopped as infections soared. Goodwill packages. However, the USA has not been a major recipient of that, and therefore there's a immense amount of shortage of surgical masks and PPE in the USA. The last topic that I'll be discussing is the role of IPC, which is also known as infection prevention and control. So every country has an IPC unit. It's just that they may have a different name to it. The main goal for IPC is to identify and treat suspected or confirmed cases as early as possible, so that it does not, by any chance, infect the healthcare staffs and services. If the healthcare services are compromised, there would be a higher chance of having a wider outbreak and impacting broader health services. So one of the main things that IPC does is that they prepare the healthcare facilities and services, which include sanitizing of staff and visitors, supplying consumables, managing infrastructure and layout of facility, and finally they fill out an assessment of preparedness, which are tools to highlight gaps and prioritize actions. They also implement a heightened surveillance within the facility in order to have an early detection of cases, so that it minimizes the risk of transmission within the facility. Additionally, they have screening on admissions, for which staffs are trained for, in order to recognize symptoms and have a controlled admission into the hospital for visitors. The IBC also encourages suspected cases to have designated rooms for treatment, because obviously if they don't test positive for the virus, and if they're roomed with people who are confirmed cases, they have a higher risk of contracting the virus. Therefore, the suspected cases are roomed together in a different isolation room. Lastly, the IPC also has to plan the flow and transfer of these patients, which also include the location of these isolation rooms or wards, because they obviously have to be linked to other departments, sanitation services, and also ventilation systems. And they also need to make sure that these patients do not come in contact with other types of patients. So that concludes episode 4 of this series. As always, if you guys have any questions, comments, or thoughts, please feel free to leave them down below. The next episode will contain information about how specific countries responded to the pandemic in terms of its policies. Until next time, see you. Bye.